So we have a tuberculin was injected intracutaneously to the child for tuberculin test. There is marked hyperemia, there is tissue infiltration, and there was what? Which developed on the place of injection in 24 hours. What is the mechanism caused this modification? What is the mechanism? In other words, what is the type of hypersensitivity in this tuberculin injection? The type of hypersensitivity. And again, I've discussed with us that we have 4 types of hypersensitivity. We have type 1, type 2, type 3, type 4. Now, if I were you, I'm going to write these things down because I'm going to give you most of the disease that you should be thinking of if you think of any of the types of hypersensitivity. If I were you, I'll write this down. So in type 1 hypersensitivity, it is also known as intermediate, anaphylactic, atopic, ranging type of hypersensitivity. And what are the examples under type 1? Allergic reaction and atopic disorders. All these are type 1. All these are type 1. And of course, anaphylaxis. That is type 1. Now, in type 2, we also call it cytotoxic reaction. Type 2 is also called cytotoxic reaction or antibody dependent. Example, acute hemolytic transfusion. Acute hemolytic transfusion reaction. Autoimmune hemolytic anemia. Autoimmune hemolytic anemia. Then we have good pastures syndrome. Good pastures syndrome. We have Graves' disease. Graves' disease. And then we have Myasthenia gravis. Myasthenia gravis. Myasthenia gravis. That is type 2. Now in type 3, also known as immune complex reaction. Immune complex reaction. Examples include SLE, systemic lupus erythematosus. SLE, systemic lupus erythematosus. We have serum sickness. Serum sickness. We have rheumatoid arthritis. Rheumatoid arthritis. We have post-streptococcal glomerulonephritis. I'm giving you all these things for a reason. Some questions, they will give you one of the disease, and they ask you what type of hypersensitivity. Like in this question now, they've given us what? A tuberculin test. So what type of hypersensitivity? So let's continue. Again, type 3, we have systemic lupus, serum sickness, rheumatoid arthritis, post-streptococcal glomerulonephritis, and so on. Type 4, also known as delayed hypersensitivity. Delayed hypersensitivity, or cell-mediated, or cell-mediated, or cellular cytotoxicity. Cellular cytotoxicity. Cellular cytotoxicity. Examples include 1. Contact dermatitis. Contact dermatitis. Then we have graft versus host disease. Graft versus host disease. That is when you are doing a transplant from one body to another, or basically a transplant. So graft versus host disease. Then we have multiple sclerosis. Multiple sclerosis. Then we have tuberculin injection. Again, we have tuberculin injection. So, what type of hypersensitivity is tuberculin injection? Of course, type 4, also known as delayed, also known as cellular toxicity, cytotoxicity, or cells cytotoxicity. And therefore, your answer is C. Your answer is C. Great. That was just by the way. I know I've spent a lot of time on it because I want you to grab it. Now, the intraoperational biopsy of a mammal gland has revealed signs of atypical tissue. Now, when we talk about atypical tissue, you are thinking of a problem with what? With tumor or with a cancer? Atypical tissue with a disorder of the parenchymal stroma proportion with domination of the last and gland structures of different size and shape, lined with single layer proliferative epithelium. What is the most probable diagnosis? What is the most probable diagnosis? So over here, we are thinking of what? Atypical what? Tissue. We are thinking of atypical tissue. And over here, so they say it has a different size and what? And shape, lined with a single layer proliferative epithelium. So here, one of the most common, tumor of the breast is fibroadenoma. Fibroadenoma. So here you are thinking of what? Fibroadenoma. And these are benign breast tumors, which are characterized by stroma and epithelial tissue. They are characterized by stroma, that is order of what? Stroma, parenchyma was stroma, and then what? Epithelial what? Tissue, single layer proliferative epithelium. So they consist of these two things, stroma and then epithelial what? Tissue. So this is what is making us go for what? Fibroadenoma. So your answer is A, fibroadenoma. There is arterial hypertension, hyperglycemia, glucosuria were observed clinically for a long time in a patient with upper type 4 obesity. We are talking about obesity. And look at it, there's what? Hypertension, hyperglycemia. What substance can lead to all of these things? Of course, you are thinking of what? ACTH. So here you are thinking of what? Cushing disease. So when there's a lot or overstimulating or stimulation of cortisol, then you are thinking of the Cushing. And in a decreased amount of cortisol, you can have the moon-like phase, those things. I think we have done it already in our previous presentation. We talked about Cushing disease or Cushing what? Syndrome. We spoke about it, where there is increased amount of cortisol level. And in most of the cases, it leads to hypertension, hyperglycemia, because cortisol causes secretion of all of these things. But look at it again. They said there's basophilic hypophysis adenoma. There's hyperplasia of the adrenal gland cortex. Hyperplasia. That means there's what? Increase in the cells in the adrenal gland. And we know that adrenal gland is responsible for the production of what? Cortisol. That's the middle layer. It's responsible for what? For the cortisol production. And therefore, increased cortisol level also means what? Cushing disease. So your answer is A. Cushing. On autopsy, it was revealed a large brownish red, easy crumbling formations covering ulcerative defects on the external surface of aortic valve. What is your most likely what? Diagnosis? Over here, they've already told you. First of all, it's taking place in the heart. So definitely we are talking about a problem with what? At the heart. So we have what? Endocarditis. Then we have what? Ulcer formation of ulcer. So even without knowing, you definitely know this is what? A polypus ulcerative endocarditis. Myocarditis. So here we are thinking of what? B. We are thinking of what? B. We are thinking of B. All right. A purulent endometritis with fetal outcome was progressing in the woman after abortion performed not at the hospital. You see, there's an abortion which is performed not at the hospital, which means that there's a possibility of a severe infection that will take place because it was not hygienically done. It was not properly protected. Okay, no antiseptics or whatsoever, no antibiotics whatsoever. So this means that there will be an increased risk of infection. Now, there's an autopsy with multiple lung abscesses. When we talk about abscesses, we are talking about a purulent inflammation or a purulent fluid that is formed as a result of of infection. As a result of and now it has become like a fluid, and now it is filling some cavities. Okay, that's what abscesses. There's subcapsule ulcers, spleen hyperplasia were all revealed. What is the form of sepsis? Like I said, there will definitely be sepsis. There will definitely be sepsis. But the question is, what type of sepsis are we looking for? What type of sepsis are we looking for? Now, we can't talk about chorioepithelioma because we are not dealing with the pregnancy itself. This is after the abortion. Now, with chorioepithelioma, it has to do with the cranium basically it has to do with the cranium. Okay, and that is part it's like a kind of epithelial tissue or the cranium epithelium. That is what it deals with. So it's like a structure, or it forms a structure of the placenta. Good. I think there's a question on it. I will take my time and then I will explain it to you guys better. So now we are thinking of what? And of course, urosepsis simply means in terms of urinary tract, okay? But this is not a urinary tract infection. This is not a urinary tract infection. So now we could be thinking of what? Septicemia or septopyemia. Septopyemia. And I'll illustrate the difference between them, and then you will know that this is septopyemia. This is what? Septopyemia. Now, what then is a pyemia? A pyemia is a type of septicemia. It is a type of septicemia that leads to widespread abscesses. It leads to widespread abscesses of a metastatic nature. Yes, metastatic nature. So it's more, so you might think that it's sepsis because it's sepsis that undergoes metastasis. It is cancers that undergo metastasis. In other words, it moves from one place and goes to the other place. That is a metastatic nature. So when we talk about a pyemia, we are talking about a type of septicemia that can lead to a widespread abscesses of metastatic nature. And if you look at the question over here, abortion normally takes place in the what? In the pelvic area, isn't it? Or in the womb. That's where the abortion took place. But patient is having what? Multiple lung abscesses. Multiple lung abscesses. There is ulcers in the kidney. There's hyperplasia of the spleen. So definitely you are thinking of what? A septicemia of a metastatic nature, which is called a pyemia. And therefore, we call this what? Septopyemia. We call it septopyemia. Now, septicemia, in case you want to know, is just a serious bloodstream infection. But when it begins to go overboard, then it becomes septopyemia. So your answer here is E. Please, I hope you have understood it. Take your time, analyze it, watch the video again, if you may, and you can get this. I'm taking my time to explain this thing because I know we might see questions on them and you might get confused. So please take note of what we are talking about here. And of course, if you still have any question, feel free to ask at the end of the presentation. All right. Autopsy of a 73-year-old man who had been suffering from coronary heart disease along with cardiac insufficiency for a long time revealed nutmeg liver, brown induration of the lungs, cyanotic induration of the kidneys, and then the spleen. What kind of circulation disorder caused such effect? What type of respiratory disorder caused such effect? Now, they've already told you that there's a problem with the cardiac insufficiency. Cardiac insufficiency. Now, if you can remember nutmeg liver, we said when there's congestion, then we have what? Nutmeg liver. If you can remember our last tutorial, that's what I said, always right. So with a nutmeg liver, you are thinking of what? Venous congestion. Venous congestion. Nutmeg liver. So you are thinking of what? Venous congestion. Venous congestion. Now, when we talk about induration, brown induration and cyanotic induration, it means there is lack of what? Oxygen. There is lack of what? Oxygen at the site. There is lack of oxygen, which denotes that there is cardiac insufficiency. There is what? Cardiac insufficiency. There is cardiac insufficiency. But look at it again. These people have been having this for a long time. A long time. So putting everything together, we can say this is a general chronic venous congestion. General chronic venous congestion. Because I've already explained the venous congestion because of what? Nutmeg liver. Then we are thinking of what? Of a chronic nature because we have what? Cardiac insufficiency for a long, long time. So you are thinking of general chronic venous congestion. So your answer is E. I love this question because we have done it and it has been repeated. 22-year-old from the West Ukraine complains of labored nasal breathing. Morphological examination of the biopsy material of the nasal mucosa revealed lymphoid, epithelioid, plasma cell, as well as mucolytic cells. Guys, do you remember when I gave you guys the different types or the specific granulomatosis or granulomas? Yes, you remember. And we said when we have what? A mucolytic cells, or when we have what? A scleroma. The lymphoid, the epithelium, plasma, they all made up of what? The scleroma. And in the other question, the answer was actually what? A scleroma. But the disease is called what? Rhinoscleroma. Rhinoscleroma. I won't waste my time and go over it again because you already know it. If you haven't or you don't know, please do well to watch the video because we talked about rhinoscleroma. We spoke about lepra or leprosy. We spoke about tuberculosis. We talk about syphilis and so on and so forth. So please take note of them. So your answer here is what? Is A. Autopsy of a man who had been working as a miner. I think we've done this question. For many years and died from pulmonary decompensation revealed that his lungs were airless, sclerosed. Their apexes had what? Emphysematous changes, grayish black. Incised lung tissue was coal black. Coal black. What disease are you thinking about? So this is what? A form of pneumoconiosis. 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 And the person has been exposed to what? Coal dust. Or he's a miner. So he has been exposed to a lot of what? Coal. A lot of what? Coal. So what disease is it called? Of course, it is called what? Anthracosis. 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 So for anthracosis, you are dealing with what? You are dealing with a pollution either of smoke or coal dust particle. Coal dust particle. Coal dust particle. So please, that is your likely answer. Examination of the coronary artery revealed arteriosclerotic plaques with calcinosis that narrow the arterial opening by 1/3. In the muscle, there are numerous whitish layers of connective tissue. Numerous whitish layers. This means that the thing is getting what? Diffused. The thing is getting what? Diffused, or it begins to what? Spread. It is beginning to spread. It is beginning to spread. So name the process detected in the myocardium. Now, atherosclerosis in the coronary artery has blocked 1/3 of the blood. This is what? A lot. So it can easily lead to what? To scarring. In the artery, there's also what? Calcinosis. That's calcium buildup over the place. And so we have one of the whitest layers of what? Connective what? Tissue. This means that the cardiac are undergoing what? Sclerosis. They are undergoing what? Sclerosis. They are changing color. They are changing color. They are changing color. So here you are thinking of what? Of a diffuse cardiosclerosis. A diffuse cardiosclerosis. And the fibrous again, the whitest layer again is telling you that there is what? A fibrous tissue about to what? To form. Fibrous tissue about to be formed. So please take note of that. Take note of that. So here you are thinking of what? Of A. You are thinking of A. Of course, you could have been thinking of maybe myocardial infarction, because when it's a blockage of the coronary artery, it first develops into myocardial what? Infarction. But this one is more severe because even the tissues are changing. You see, it is changing. It is changing. The normal tissue are being replaced with a fibrous tissue. With a fibrous tissue. All right. We're having a 63-year-old man who had been suffering from chronic diffuse obstructive disease. When we say obstructive, that means there was a blockage of what? Inflow and outflow of what? Of air. Now there's pulmonary what? Emphysema. For 15 years, died of cardiac insufficiency. Again, they told that the person died of what? Cardiac insufficiency. And there was what? Chronic diffuse what? Obstructive disease. Now, autopsy revealed, do you remember nutmeg? Yes, it means there's what? Congestion. Congestion. And again, if you have congestion, there could be a problem with what? With the heart. So we call it what? The cardiac what? Insufficiency. And of course, they've told that this person having what? Cardiac what? Insufficiency. And look at it again. We also have what? A cyanotic induration. Guys, are you seeing? Cyanotic what? Induration. We're having kidneys, of the kidneys and the spleen. We're having ascites, edema of the lower limbs. What it means is that fluids are all over what? The body. Fluids are all over the body. So either there's a problem with what? With the heart, or the liver, or the kidney. But obviously, this is a problem from the heart. Now, these changes of the internal organs are typical for the following what? Disease. Of course, this has taken place for 15 good years. 15 good years. 15 good years. So this person is having what? A ventricular what? Insufficiency, or a chronic right ventricular insufficiency. Now, someone might ask, why right? It is right because when the right side of the heart is affected, that is where venous blood cannot enter. Venous blood cannot enter. Don't forget, venous blood enter into the what? Into the right atrium. Venous blood enter into the right atrium through the inferior vena cava. So when the right heart is not forming properly, what it means is that every blood that's supposed to go there will begin to what? To stay. It becomes stagnant. And therefore it will lead to what? Nutmeg liver. It will lead to what? Edema of the lower limbs. It will lead to what? Ascites. and so on and so forth. So this is more classic with right ventricular insufficiency, but of course it is chronic. So this is what chronic right ventricular insufficiency. Chronic right ventricular insufficiency. Good. We have a microscopic examination of an enlarged cervical lymph node, revealed blurring of its structure, absence of lymphoid follicles, or the microscopic field showed cells with roundish nuclei and thin limbus of basophil cytoplasm. It is known from the clinical data that other types of lymph nodes are enlarged, as well as the spleen and then the liver. What might be suspected? What might be suspected? So over here, they are telling that there's what an enlarged lymph nodes, or the other groups of lymph nodes that are enlarged. That are enlarged. So definitely you could be thinking of a problem with what called lymphoid leukosis. Lymphoid leukosis. Lymphoid leukosis, which is a type of malignant neoplasm characterized by the proliferation of cells native to the lymphoid tissue. That is lymphocytes. Lymphocyte. So these nodes being enlarged, cervical lymph nodes being enlarged, is all pointing to lymphoid leukosis. Lymphoid leukosis. Lymphoid leukosis. So basically, that is what we are talking about, lymphoid leukosis. So it's a malignant neoplasm of the lymphocyte, Of course, there are a lot of differentials which more or less look like very close, but this is lymphoid leukosis. Good. A worker of a cattle farm fell acutely ill and then died from a progressing intoxication. Look at the analysis. A cattle farm. Autopsy revealed enlarged hypostenic spleen and a dark cherry color when dissected, excessive pulp scraping. At the base and the funnels of the brain, pia maters are edematous, soaked with blood, dark red or scarlet hearts. This is also a clue. Microscopic examination revealed serous hemorrhagic inflammation of the brain and the tonus, along with destruction of small vessel walls. So you are talking about a scarlet fever, and you are dealing with somebody coming from somebody who deals with the farm. And what is normally common? You are thinking of anthrax. You are thinking of anthrax. And an anthrax is an infection caused by the bacterium Bacillus anthracis. Bacillus anthracis. Anthracis. And of course, it is also characterized by the cherry red spleen on the cut surface. There can be edema of the meningitis or the meninges. And of course, there can be hemorrhagic inflammation as well. So here we are thinking of anthrax. We are thinking of anthrax. So here your answer is D. Your answer is D. I love this question too. Histological examination of a skin tissue sampling revealed granulomatous. Guys, again, we talk about granulomatous. We spoke about Rhinoscleroma, Syphilis, Tuberculosis, Leprosy, and so on and so forth. So please check your notes. Consisting of microphageal nodules with lymphocyte and plasmatic cells. There are also some big macrophages with fatty vacuoles containing causative agent of the disease packed up in the form of spheres. Do you remember Faircough's cells? Faircough's cells. Yes. So what type of granuloma are you thinking about? You are thinking of what? Of a lepra. Or Leprosy. So this is lepra or leprosy. Why? Because there's a presence of what? Virchow cells. In syphilis, you are thinking of goma cells, goma cells, goma cells. So please take note of that. A 40-year-old man noticed a reddening and an edema of the skin in the area of his neck that later developed into small abscesses. Okay. The incised focus is dense and yellowish green. The pus contains white granules. There's druncing of a fungus, plasmatic and exanthome cells. Xanthome cells are very, 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 very specific for actinomycosis. Xanthome cells, not xanthine, xanthome. Xanthome cells are very, very specific for actinomycosis. Actinomycosis. So here we are thinking of A, actinomycosis. All right. A physician examined a patient and found an inguinal hernia. Through what anatomical formation does it penetrate into the skin? Through which anatomical formation does it penetrate into the skin? So here you must know your anatomy. You must know and unfortunately, I don't have a diagram to show you what this is. But basically, this is what? This is definitely hiatus saphenous. Hiatus saphenous. Hiatus saphenous. And the saphenous opening is always located inferior-lateral to the medial aspect of the inguinal ligament. Again, this saphenous opening is located inferior-lateral to the medial aspect of the inguinal ligament. So here you are definitely thinking of hiatus saphenous. Hiatus saphenous. I don't know how to explain it again. I can really tell you the anatomic structure, and you must see the structure. So if I were you, after here, I'll go and look at what? The hiatus saphenous and see where it is located in the connection with the inguinal hernia. All right. Don't forget when we say hernia, that means there's what? A protrusion of the stomach content. Good. An autopsy of a man died from a burn disease and revealed brain edema, liver enlargement, as well as enlargement of the kidneys. With white, light gray cortical layer and plethoric medullary area. Microscopic examination revealed necrosis of the tubules of the main segment along with destruction of the basal membrane. Interstitium edema with leukocytic infiltration and what? Hemorrhages. What is the most post-mortem diagnosis? So now so over here, we are looking at a problem relating to what? To the kidney. We are looking at a problem relating to the kidney. And over here, they are telling us that there is necrosis of the tubules. There is necrosis of the tubules. So actually, this disease is called acute tubular necrosis. Acute tubular necrosis, also known as necronephrosis. Necronephrosis or necrotic nephrosis. They all mean what? Acute tubular necrosis. Acute tubular necrosis. And this is a medical condition involving the death of a tubular epithelium or epithelial cells that form the renal tubules of the kidney. It forms the renal tubules of the kidney. And you know the renal tubules is where the urine and all will pass and enter into the ureter and so on and so forth. So here again, we are thinking of what? Acute tubercular necrosis, also known as necronephrosis or necrotic nephrosis. Why? Because we are having what? Necrosis of the tubules. Again, we are having what? All these are all signs of what? Inflammation. Signs of inflammation. A 30-year-old man had been suffering from acute respiratory disease and died from cardiopulmonary decompensation. Autopsy revealed fibrinous hemorrhagic inflammation in the mucous membrane of the larynx and the trachea, destructive bronchitis, and large lungs that look black due to the multiple abscesses, hemorrhages, and necrosis. What is the most probable post-mortem diagnosis? Post-mortem diagnosis. So over here, we are looking at for influenza, 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 influenza. Because in influenza, we can have complications if it is not what treated. Some of them are enlarged lungs. We can talk about interstitium emphysema, that's enlarged lungs. We can talk about necrotic foci. We can talk about abscesses. We can talk about obliterating bronchitis, bronchiolitis, bronchoectasis, and then chronic lung diseases. All of these things can develop in a person suffering from what? Influenza. A person suffering from what? Influenza. And again, they've told the person having what? Acute respiratory disease. Acute respiratory disease. So this disease could be the one causing all of these symptoms or presentations. So here you are thinking of a influenza virus. Influenza virus. I've seen the question here. They are saying that a man with a wound of his limb that had been suppurating for a long time died from intoxication. When we say intoxication, poisoning. Now, autopsy revealed extreme emaciation, dehydration, brown atrophy of the liver, myocardium, spleen, and cross-striated muscles, as well as the renal amyloidosis. Renal amyloidosis. Amyloidosis simply means proteins that are being deposited in the kidneys. Proteins, abnormal proteins, anyways. So, what is the presentation in this patient? What is the case in this patient? So, basically, this patient is suffering from a severe form of sepsis. A severe form of what? Sepsis. A severe form of sepsis called chorioepithelioma. Chorioepithelioma. So over here, it doesn't heal and it progresses to what? Chronic. It doesn't heal and progresses to what? To chronic. Now, in organs and tissues, you could see atrophy, you could see dehydration being what? Expressed. You could see brownness of the liver and then the myocardium, and then the what? There can be a decrease in the spleen as well. Decrease in the spleen as well. So over here, again, you are thinking of what? Chorioepithelioma. Chorioepithelioma. Or actually, the word chronio means chronic. Sorry. The word cranio means chronic. Chronic. Please take notes. Write it down. The word choriocepsis means chronic sepsis. Chronic sepsis. Chronic sepsis. Too much information gets us confused. But it is chronic sepsis. I just realized what I was talking about. It's chronic sepsis. Chronic. So here we are talking of what? Of A. Chronic sepsis. Okay. I think I'm confusing it with this question. You will see it here. We are having a 6 months After labor, a woman had uterine hemorrhage. When we say uterine hemorrhage, bleeding from the uterus. Gynecological examination of the uterine cavity revealed dark red tissue with multiple cavities resembling a sponge. Microscopic examination of the tumor revealed a blood lacunus. Now, when we say atypic, what comes to mind? Yes, you are thinking of a tumor. We have looked at the lacuna, we have atypic light epithelial Langerhans cells and giant cells of syncytiofibroblasts. And this syncytiofibroblasts forms part of the placenta. It forms part of the placenta. And the tumor, like you see, what tumor is it? So you are thinking of what? Syncytiofibroblasts. And I was saying that, because that's why I was making that mistake, thinking that the craniosepsis is same as what? Chorioepithelioma. My mind was on epithelioma. So this one, we are dealing with what? Chorioepithelioma. Chorioepithelioma. So here you are thinking of what? Of D. Like I said, all of these cells, as part of the syncytiofibroblasts, are all talking about chorioepithelioma. And this is a malignant trophoblastic cancer. Usually of the placenta. So again, we are thinking of what? Of D. Oh, another easy question again. A patient was Android type obesity, suffering from hypertension, hyperplasia, glucosuria. Remember, we solved almost similar question. Now look at the cortex. Hyperplasia. Adrenal cortex is what? Hyperplasia. So again, what comes to mind? You are thinking of what? Cushing syndrome, Cushing disease. These are the things that comes to mind. Cushing disease or Cushing syndrome. Where there will be increased amount of what? Cortisol level. So please don't get confused. Your answer is D. Mucous membrane of the right palatine tonsil has a painless ulcer. It has a painless ulcer. I think we talk about some sores. When we have a lot of sores under the private parts, a lot of sores that are painless. We've spoken about it over here before. Now we have a painless ulcer with a smooth lacquer fundus and a regular cartilaginous edges. Microscopically, we have infiltration that consists of lymphocyte, plasmocyte, and a small number of neutrophil epithelioid cells, blah, 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 blah. What disease are they talking about? So again, you are thinking of what? Painless ulcers in the palatine. So you are thinking of what? A syphilis. You are thinking of syphilis. And again, the chronic form of syphilis, you could be looking at for what? For guma. You could be looking for guma. But this has not gone too deep. This is just primary sort of form of syphilis. So here we are looking at what? D. Don't go and say because of ulcer, I'm going to do ulcerative necrotic. No. This is painless ulcer. And that you are referring to what? Syphilis. So your answer is D. Okay. What do we have here? An autopsy of a man with malignant stomach tumor who had died from cancer intoxication revealed posterior inferior lung filled some dense, grayish red irregular foci protruding above the surface. Microscopic examination revealed exudates containing large amount of neutrophils. That means there's inflammation in the lumen and the walls of small bronchi and the alveoli. And the alveoli. So bronchi and then what? Alveoli. Bronchi and then alveoli. This is your clue. So such pulmonary alteration indicate the following. So over here, you are thinking of bronchopneumonia. Kevin! Sorry, guys. So over here, you are thinking of what? Bronchopneumonia. Because the bronchus and then the alveoli are all what? Are all included in this case. Difference in pneumonia. But what of pneumonia? We are talking about bronchopneumonia. 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 And if you can remember the types of the types of exudate, I said we have what? Serous exudate. And a serous exudate look just like what? It's like a clear fluid. It's like a clear fluid. I've not finished it. I have to remove some of this and put it there. So, but I'll do it for you, so don't worry. I'll copy. Maybe tomorrow I'll give it to you. Yes, tomorrow I'll give it to you. Okay. All right. All right. Sorry for that. So back to what I was talking about. We are having an exudate that is having what? Large amount of what? Neutrophils. Neutrophils are normally what? Clear. They are white, isn't it? They are normally what? White. So this of a serous origin. Serous. Sorry, this is purulent. Sorry. Neutrophils are not actually, how do you call it? They are not white. Sorry, they are not white. They are not white. This one looks like a pus. It will look like a pus because it's called neutrophil. Look like a pus. So this is actually what? Purulent, not serous. Purulent. In serous, you are thinking of a clear what? Fluid. Clear fluid. And it will have been stated clear fluid, but this is not what? A clear fluid. This is what? A purulent fluid. So you are thinking of acute purulent. That means pulse is present. Pulse is present because neutrophilic. Please take note. And I didn't easily go for just cropos pneumonia because we're thinking of what? The bronchi and then the alveoli. Now, in the other ones, you are just thinking of what? Either just the alveoli or the bronchi. But this is both the bronchi and then the alveoli. So your answer is E. All right. Microscopical examination of a removed appendix revealed an edema, diffuse neutrophilic infiltration of the appendix wall along with necrosis and defects of the mucous membrane. Look, we have edema, we have diffuse neutrophilic infiltration, which means signs of inflammation is taking place, of course, of purulent origin or pus origin. Then we have necrosis. That means ulcer is developing. They've told you that there's a defect of the mucous membrane. That again confirms that there is what? Ulceration. So what appendicitis form was developed? What appendicitis form was what? Developed. So first of all, defect of the mucous membrane, you are thinking of what? An ulcer. But so this one is called what? Pulmonous ulcerative appendicitis. That is the actual name. Pulmonous ulcerative appendicitis. And the phlegmonous is simply what? Inflammation with necrosis and ulceration in the mucosa. That is what phlegmon or phlegmonous is all about. Phlegmonous describes what? Inflammation with necrosis and ulceration. necrosis, and ulceration. And that's what over here we can easily go in for what? For E. Ulcerophlegmonos, phlegmonos. All right. A 39-year-old woman went through an operation in the course of which surgeons removed her uterine tube that was enlarged and a part of an ovary, with a big cyst. Histological examination of the tube wall revealed decidual cells. Sorry. And then the cranium what? Villi. What is the most probable diagnosis made after examination of the uterine tube? Look, they've told you that there is an enlarged what? They removed the uterine tube. Uterine tube is like the fallopian tube. It is the fallopian tube or the tubes. Okay. That was what? Enlarged. So what could happen is that there could be, and now look at it again. And they are saying in the histology, in the tube, we have decidual cells. Now, decidual cells and in the cranium valley, these are remnants for fertilization or remnant for implantation. In fact, it is a remnant for implantation. This means that there was an implantation of pregnancy inside the tube. All right, inside the tube. And that term is called tubal pregnancy or ectopic pregnancy. So here we are thinking of ectopic pregnancy, also known as tubal pregnancy. So your answer is B. All right. We are having autopsy of a 1.5-year-old child who revealed what? Hemorrhagic skin rash, moderate hyperemia, edema of the nasopharyngeal mucous membrane, small hemorrhages in the mucous membrane, and then what? The internal organs. Look at it. There is rash, and there's what? Hemorrhage. Rash, there's hemorrhage. Look at it again. There's dramatic dystrophic alteration in the liver and then the myocardium. Acute necrotic nephrosis. And remember what a necrotic nephrosis is, right? Yes, that's acute tubal problem, acute renal problem. And there's what? Massive hemorrhage in the adrenal gland. What disease are you looking at for? So what disease or what kind of infection can present with almost systemic problem? Definitely you are thinking of meningococcal infection. And we have talked about this before. And if it begins to affect the brain, we are talking about encephalitis. And if we start having meningeal symptoms, we're getting what? Meningococcal meningitis. So over here, we are thinking of meningococcal infection. All right. Now, another interesting question, which we have already done, but this has been put in a different way. The question says 48 hours after tuberculin test. If I were you, I won't read anything again. The question now is, what hypersensitivity is it? I've mentioned 4 types: type 1, type 2, type 3, type 4. Now, if you wrote what I said at the beginning of the tutorials, you will realize that this is type 4 hypersensitivity reaction, also known as cellular cytotoxicity or cell cytotoxicity. So your answer is A. All right. A colonoscopy of a patient ill with dysentery revealed a mucous membrane of his large intestine is hyperemic, edematic. Its surface was covered with gray and green coats. Gray and green coat. Name the morphological form of dysenteric colitis. Name the morphological form of dysenteric colitis. Again, I've made mention again that we have what? 4 stages of dysenteric colitis. We have the catarrhal, we have the fibrinous, we have the ulcer formation, and we have the healing of the wound. Healing. Now, in fibrinous, it is characterized by fibrinosuppurative exudate. Fibrinosuppurative exudate, which diffusely covers the mucosa and produces a dirty, grayish pseudomembrane. Dirty, grayish pseudomembrane consisting of necrotic mucosa, neutrophils, fibrins, and erythrocyte. Again, in fibrinous, we are thinking of what? A fibrinosuppurative exudate, which diffusely covers the mucosa and produces a dirty, grayish pseudomembrane consisting of necrotic mucosa, neutrophils, fibrin, and erythrocytes. So over here, we are thinking of what? Fibrinous. We are thinking of fibrinous. So your answer is B. Is B. All right. A patient has been suffering from diarrhea for 5 days. On the 5th day, colonoscopy revealed the membrane of the rectum was inflamed. There were grayish green films. Can you remember what we just did? Yes. So you are definitely thinking of what? Dysenteric what? Colitis. Dysenteric colitis or dysentery. Dysentery. It is just like the previous question. But this time around, they didn't give the diagnosis. They want you to give the diagnosis. The other one, they gave you what? The diagnosis, and they asked you to tell them the stage of the disease. So what stage is it? This is what? Fibrinous. This stage is what? Fibrinous stage. So please take note. Fibrinous stage. Autopsy of a 48-year-old man revealed a round formation, 5 centimeters in diameter, with clear-cut outlines in the first segment of his right lung. The formation was encircled with a thin layer of connective tissue full of white, brittle masses. Make a diagnosis of secondary tuberculosis form. This is they've even told you the answer. Secondary what? Tuberculosis form. And they've told this is what? A specific mass. Specific. They've even told you the diameter. So definitely you are thinking of what? A tuberculoma. You are thinking of a tuberculoma. A tuberculoma. And the size is normally between 2 to 5 centimeters. 2 to 5 centimeters. So here is what? A. All right. We have indirectly solved this question. Guys, look, he worked in a coal mine. So what sort of pneumoconiosis will you be thinking about? Exactly the same thing. Somebody who is exposed to smoke and coal dust, you are thinking of what? Anthracosis. You are thinking of anthracosis.